Hello everyone. Today our group and I will discuss a wicked problem, childhood obesity. For childhood obesity, the WHO found that globally in 2016, the number of overweight children under 19 was about 380 million. Obesity in children not only poses a serious threat to their own physical health, but also imposes significant pressures on the country's medical level and the economy. Therefore, our group will use integrative thinking as a framework to find an effective solution to this problem. Let's switch to stage one. Our model works to address childhood obesity. If this problem can be successfully alleviated, it can save some medical resources. Family would also save money by no longer have to treat obesity-related illnesses. Children will be able to have a healthy childhood and a future adult life. Two approaching models were identified in our group. Model 1 is to prevent childhood obesity before it occurs, and Model 2 is to treat it after it occurs. For Model 1, our survey found that due to genetics and mother inappropriate dieting during pregnancy, childhood obesity occurred for about 14 to 16% of all obese children. In view of Model 2, seeking the help of professional doctor after childhood obesity has occurred. If the consider is serious, intervening with medication the surgery. In fact, the United States has already used weight loss pills for children over 18 years old. As shown on the slide, we list the possible players into models and analyzed what they can do and the benefits they bring. Firstly, the government is undoubtedly one of the important players as they regulate through marketplace, which can reduce the production of unhealthy food and provide more medical channels. The second player is the food manufacturer, which provide parents and children with more choice in food. Another player is a customer who may need to change consumption habits. The final player is school. By providing basic knowledge education, courage, and exercise, children can have healthy lifestyles.
Thank you for introducing our option model. In my section, the model will be examined. I summarize the similarities between Model 1 and 2. Firstly, they have the same purpose. Secondly, both achieve it by controlling debt and seeking assistance from hospitals and science. On the other hand, they also have difference. From the perspective of the government, food manufacturers, and consumers, the most significant difference is the target audience. The farmer mainly targets parents, manufacturers, and schools, while the latter mainly targets sick children. From the perspective of the school, Model 1 mainly provides education, where Model 2 provides guidance on that and access for obese students. It is also necessary to study their respective strengths. Model 1 can help parents prevent childhood upset, greatly reducing the risk of weight gain in the child's growth. Model 2 can prevent infective treatment after a child's illness, without constantly making healthy children entering their craving for delicious fast food. At the same time, the model also faces difficulties in practical operation. For Model 1, we have learned that in some regions, people lack the ability to take testing programs due to income and technological backwardness. Model 2 faces the problem of parents neglecting measurement. For example, many parents do not consider their children's obesity to be a concern. Also, some children's unhealthy habits are difficult to change. The next speaker is Han Yao, who will explore the possibility in the models.
In this section, I will explore the possibilities of the model in three pathways. Firstly, pathway 1 extracts the most favorable features from the two models. For model 1, we believe that the physical examination of parents predicts the prevalence of children. To be more specific, the government requires medical institutions to add testing items for the risk of obesity in offspring. The most valuable point of Model 2 is to seek professional medical treatment after the child is diagnosed with obesity. The solution based on players is to seek the help of hospitals or dietitians to help children slowly adapt to healthy eating habits and encourage them to exercise according to the plan. Secondly, let's use another pathway. I will extend Model 1 by using the casual model. The core measure of Model 1 is to prevent that has not yet occurred by genetic testing and promoting the importance of a healthy lifestyle. At the same time, we found that the most important element in Model 2 is to increase the attention given by parents and children to the onset of childhood obesity. So we have gained a new causal relationship, that is, by promoting the causes and treatment methods of childhood obesity, heighten the basic knowledge of the disease. Among them, as one of the players, the government can take measures to publicity on their website, guiding families to pay more attention to the impact of their genes and lifestyle of future generations. Schools can offer relevant courses to promote knowledge about childhood obesity. Another different pathway is to decompose the initial problem into small parts and apply different models to different parts. In pathway 3, we set the core assumption as the government formulating new policies. The government needs to first sponsor research on analytical techniques, medication, and surgery. Secondly, establish strict regulation for schools to ensure the exercise time of students on campus. Finally, encourage restaurants that sell weight loss meals and open branches. In response to government policies, other players have also taken actions, such as strive to provide obese children with safe and effective medication and healthy meals. That is all of my part. The next speaker will evaluate the prototype.
In this section, I will evaluate and make the model more specific, analyze the elements, and design tests through 3 steps. Step 1 will explain how each player specifically works in the model. First of all, the government plays an important role. They need to post public services announcements about childhood obesity in public places. When publishing, using different styles such as cartoons to attract children's attention. In addition, the direction of the funds used to develop medication should be clearly stated on the official website, rejecting the corruption. Secondly, for food manufacturers, increasing investment in the research and development of children's weight loss meals and pregnant women's nutrition meals is undoubtedly the most necessary measure. It is also need to promote the products and offer discounts to attract consumers to purchase. Let's take our attention to the consumer. Focusing on the importance of parents, evaluate the physical condition before giving birth. Moreover, parents should check children's weight regularly and develop dietary and exercise plans for children according to the doctor's guidance. By allowing them to log in and receive appropriate rewards to encourage. The last player is school. They need to develop a reasonable campus life schedule for their students and provide different types of sports equipment and venues. Also, establish clubs. Finally, they need to provide weight loss meals in schools' restaurants. Let's come to the second step. To analyze the conditions required for each solution to be successful, firstly, for the government, a major issue is that it requires attention of officials. In addition, in terms of funding, the country needs to have sufficient money to invest in disease research. Consumers and schools also face financial issues. The former requires higher funds for physical examinations and have enough time to manage their children's diet and weight after finish their busy work, while the latter requires higher costs to sell the weight loss meals, which affects some profitabilities of schools. Food manufacturers are facing a situation of insufficient demand, which is likely to lead to losses and food waste. In step 3, for testing each possibility, we believe that the NAO system is already in use in the United States to investigate the growth rate of childhood obesity. Another effective measurement method is use food EPI data to detect food health, and this data can also use to supervise food manufacturers. Finally, for consumers and schools, the survey of questionnaire is an effective test of whether the test subjects have a basic knowledge of childhood obesity, and whether students have enough exercise time and weight loss meals to choose at school. This is all of my part. The next speaker will make a final solution statement and summarize it.
In this part, I will propose some specific solutions based on the previous model. In my opinion, the best solution is to combine Model 1 with Model 2, which requires active prevention, so scientific predictions. At the same time, it is necessary to arrange a treatment plan after the problem occurs. To the government, firstly, develop relevant laws and regulations, adding children's obesity risk testing programs, clearly informing high-risk parents of the results and preventive measures. Secondly, improve medical standards, expanded relevant scientific research projects, provided more effective medications and surgeries for treating childhood obesity. As for consumers, arrange a lifestyle for children, regardless of whether a child is sick or not. Parents should pay attention to their children's daily calorie intake and exercise. Moreover, seek medical attention promptly. If a child's weight is abnormal, seek medical help instead of ignoring it. Finally, to school, reasonably arrange school time. Schools should encourage students to exercise and provide weight loss meals. In this project, we conducted a comprehensive analysis of two models for solving childhood obesity and studied the advantages. Afterwards, we combined two opposite models and confirmed the feasibility and effectiveness of this new model. Finally, we created an optimal new model to reduce childhood obesity, that is, both prevention before obesity and effective treatment after onset. In addition, effective measures have been proposed for each players. This is all of the content of our report. Thank you for your listening.